This video shares some experience of a terrifying situation that occurred after first intimate encounter. From the shock of seeing blood in urine to seeking medical help, I opened up about how societal structure could be affecting people's health. Join me as I shed light on a topic often shrouded in silence and stigma. Mrs. Esther has been married to her husband for some while, and they are yet to have an intimate relationship because Mrs. Esther is scared. One day Esther overcame her fears and did it, but after 3 days she noticed that she was having pains whenever she peed. Initially, she ignored it, but later found out that she was now peeing blood and the pain was now constantly in her stomach. She informed her husband, but he too was inexperienced in such a matter and equally uncomfortable telling anyone about the situation. Days turned into weeks and the pain became severe. So one day, she could not bear it any longer. She lashed out on her husband, demanding they find a solution. This is how it went down. Esther, why don't you want to take me to the hospital? Husband, it will stop. I did some research and there is no need to worry. Esther, but I am still in distress. Husband, take paracetamol. Esther, I have done that but still in pain. Husband, just give it the time, it will resolve. Give the drug time to work. Esther, do you even love me at all? I have been telling you that I am in pain for weeks and all you could say is to endure it. Husband, what do you want me to do? Esther, call your elder brother and tell him. A few hours later, Esther opened her phone to see a message from one of her husband's relatives, and the message goes as follows. If you do not respect your husband, you are not following the teachings of Christ to be a virtuous woman. Forget all these Western teachings that man and woman are equal. Mrs. Esther was wondering why this message was sent to her. Then she received a call from her husband's elder brother's wife. The conversation went as these. Let's call her Ruth. Ruth, your husband told me what is happening. Just give it some days and you will stop bleeding. Esther, it is over 2 weeks now and I am having severe pain. Ruth, oh, that is serious. Okay, I will get back to you. A few hours later, Esther's husband walked in. Esther, why did you go and lie to your family? You know how I have been in pain all these days. Husband, you just want me to waste money and I don't see anything wrong with you. Esther left her husband to call her auntie. The aunt called her husband and threatened him with blame if anything should happen to Esther. The husband grudgingly took her to the hospital and it was discovered that she had urinary tract infection. You may be wondering why it took this couple time to seek medical help. Reasons are, it is a taboo to discuss sex. What happened between husband and wife should not be a topic of discussion outside the matrimonial bedroom. The mentality of self-medication. Taking family members as a family doctor, even if they have a medical license, emotions can clog judgment. Now let us look at what could have happened if a death medical consultation had not been carried out on time. UTI untreated can lead to complications. These could have happened to Esther if she did not fight for her to be medically checked. 1. Kidney damage and scars. TAO. High blood pressure. 3. Septic shock, which is unattended, can lead to death. So if you notice any of these symptoms, please do well to visit a doctor as soon as possible. Pain while urinating. Increased frequency of urination. Difficulty passing out urine. Blood in the urine. Presence or absence of fever. The increased sudden need to pee. Abdominal pains or pain in the groin. Thank you for watching my story unfold. Remember, your health and well-being should always come first. If you've experienced something similar or have any concerns, don't hesitate to seek medical advice. Let's continue to support each other through open conversation and understanding. Until next time, take care. See you next week on Saturday for Health Stories.